Okay, Sophia, so Cityblock Health, this model they've developed, it feels like a pretty radical shift in how we approach care, right? Can you break it down for us? Like, what exactly are they doing differently that makes it so impactful?
Sure, David. At its core, Cityblock Health is addressing the gaps in traditional healthcare, especially for populations that are often underserved. It's not just about treating the medical condition in front of you, it's about addressing the broader context, things like housing, mental health, even social isolation, all at the same time. They offer a holistic integration of healthcare and community services, which makes their model unique.
Wait, so like, they're not just doctors prescribing medicine or scheduling surgeries. They're actually helping people with, say, housing or social stuff?
Exactly. It's called addressing the social determinants of health. Think of it like treating the person as a whole, not as a collection of symptoms. For instance, if someone's health problems stem from a lack of stable housing, it doesn't matter how much medication you prescribe. The issue won't really go away. Cityblock designs care around the entire individual, often using community health partners to bridge the gap between medical care and these social factors.
That honestly makes so much sense. But it feels like something that should, I don't know, be standard everywhere. Why isn't it? What's holding us back from just doing this everywhere?
Great question. Part of the problem lies in how healthcare has been structured financially. Most systems operate on a fee-for-service model, meaning providers get paid for every test, every visit, every procedure, whether or not the patient actually gets healthier. Cityblock, though, uses a value-based care model with capitated payments. That means they get a fixed amount of money per patient annually, regardless of how many services they provide. If they can deliver care for less than that amount, they save money. If they go over, they lose money.
Whoa, okay. That seems risky.
It is, but it also encourages efficiency. Instead of piling on unnecessary tests or treatments, Cityblock has a real incentive to keep patients healthy and out of the hospital. And that's where their focus on upfront, preventative care and social services comes into play. It's more cost-effective to help someone stabilize their housing situation than repeatedly treat them for conditions made worse by chronic stress.
All right, but if this makes so much sense, financially and for better outcomes, what's stopping other providers from jumping on board? Is it just inertia?
Partly, yes. Some of it is cultural. Healthcare systems are notoriously slow to change. Plus, shifting payment models requires cooperation from insurance companies, state Medicaid programs, and even federal regulators. That's a lot of stakeholders to align. But also implementing this kind of care is logistically complex. You need systems in place to coordinate services, track outcomes, and manage costs. Not every organization is equipped or willing to make that kind of investment upfront.
So it's not as simple as just hitting copy-paste on Cityblock's model. Got it. Still, it sounds like they're finding a way to make it work, financially speaking.
They are. And honestly, what's impressive is that they've scaled this while maintaining a clear focus on equity, making sure care is distributed fairly and reaching the people who need it most.
Right. So you mentioned equity and reaching those who need it most. Let's dive into that. Who exactly is Cityblock helping, and where is this actually happening?
They're primarily serving marginalized communities in states like New York, Massachusetts, and Connecticut. These are often areas where access to regular care is, well, severely limited. Over half the people they serve are over the age of 60, which makes sense because older adults tend to have more complex healthcare needs.
And it's not just age, though, right? Like, what about other factors? Gender or ethnicity?
Exactly. More than half of their members are women, and about 25% identify as Black, 21% as white, and 3% as Hispanic. The rest either identify as multiracial or didn't disclose their race or ethnicity. And these demographics aren't accidental. They reflect the populations that are statistically more likely to experience disparities in healthcare access and outcomes.
Got it. So they're really zoning in on groups that you could say the system kind of overlooks?
That's right. The interesting part is how they're financially structured to serve these populations. They operate under a model known as capitated payments, where payers, like Medicaid, give them a fixed annual amount for every member they serve. If they manage to provide care for less than that, They get to keep the savings.
Ah, so it's like a, what's the term, risk-reward system.
Exactly. And it flips the usual dynamic in healthcare. Instead of getting more money for doing more procedures or tests, they're rewarded for keeping people healthy and lowering overall costs. It's why they invest so much in preventative care and addressing the root causes of poor health.
Okay, but that sounds like a really delicate balance. What happens if they go over budget?
Then they absorb the loss. It's part of the risk in taking a value-based approach, but the model creates a strong incentive to focus on efficiency and keep patients out of expensive settings, like emergency rooms.
So you're telling me this all hinges on, like, figuring out exactly what's going to work for this really specific group of people.
Pretty much. It's what makes their model bold but also complicated to replicate. Not every organization has the capacity, or frankly the willingness, to take on that amount of risk while also prioritizing equity and long-term outcomes.
All right, Sophia, considering how intricate and bold this model is, who's actually driving these initiatives at Cityblock? Like, who's at the helm making these decisions?
That would be Dr. Cameron Matthews. She's the Chief Health Officer at Cityblock, and honestly, she's an impressive figure. She holds both an MD and a law degree, so she's not just deeply rooted in the medical side, but also understands the legal and systemic challenges in healthcare.
Wait, she's a doctor and a lawyer? Are you serious? That's like overachieving on a whole other level.
Right? But, it makes sense when you consider the scope of what Cityblock does. Her role bridges clinical care and structural reform, and having expertise in both areas is a huge advantage.
Okay, that's, yeah, pretty impressive. So what exactly does she do as Chief Health Officer?
Her job is to oversee the clinical and health equity strategies at Cityblock. That means she makes sure the care they're providing is not only effective, but also equitable. She drives things like care delivery innovations and addresses the underlying disparities that the populations they serve face.
Gotcha. So she's kind of like, the person making sure all the moving parts fit together?
Exactly. And she's particularly focused on using data to guide decision-making. They rely on a lot of analytics at Cityblock to identify trends, predict patient needs, and measure outcomes. Dr. Matthews leads that charge, ensuring that medical decisions align with their mission of equity and efficiency.
So it's not just about, like, having a good idea. It's about proving it actually works. That's her thing?
Yes, and she's a strong advocate for pushing past traditional models of care. Before joining Cityblock, she worked extensively with the Department of Veterans Affairs, so she's no stranger to serving populations with complex needs.
Huh. So she's been tackling, like, deeply ingrained issues for a while now.
Absolutely, and her legal background gives her the ability to navigate policy barriers while designing care models that are, well, frankly, revolutionary in the healthcare landscape.
Man, the more you tell me about her, the more she sounds like someone who was, I don't know, tailor-made for this kind of high-wire act at Cityblock.
It's true. Her combination of skills and experience seems almost custom-built for leading in this space, and her leadership helps ensure Cityblock stays on mission, addressing disparities and integrating care deeply within communities.
All right, Sophia, speaking of leadership and addressing disparities, let's talk about the big picture stuff. Social determinants of health, things like housing, food, and all that. These are massive factors, right? So how's Cityblock actually tackling them in a way that's really making a difference?
Right, David. Social determinants are, well, essentially the conditions in which people live, work, and age. And they have a massive impact on health outcomes. What Cityblock does differently is they integrate these elements directly into their care model. They're not just asking patients about their housing situation, they're actively helping resolve it.
Wait, hold on. You mean like literally helping someone find stable housing?
Exactly. Let me give you an example. One of their patients was dealing with uncontrolled diabetes, but a huge part of the problem was that they didn't have a refrigerator.
What? No fridge?
Right, it sounds simple, but think about it. No refrigerator means they couldn't store their insulin properly or keep fresh food. Cityblock stepped in, addressed the immediate issue by getting them a refrigerator, and also connected them to resources for affordable housing. That patient's health improved dramatically because the root of the problem was addressed.
Okay, wow. So it's not just throwing meds at symptoms, it's going upstream to fix, like, the actual cause. That's kind of incredible.
Exactly. And this approach is tailored to each patient. Another example, there was a woman with COPD who was constantly landing in the ER due to flare-ups. Turns out she lived in a building with terrible air quality, so Cityblock partnered with her to find better housing, and those ER visits, they dropped significantly.
Wow, those feel like such common sense solutions. But I guess most healthcare providers wouldn't even think to look at stuff like that, right?
Exactly. Traditional healthcare often stops at prescribing inhalers and calling it a day. Cityblock goes further by addressing why the condition's happening in the first place. Their community health partners are a key part of making this work. They build relationships, understand patients' lives, and connect them to real solutions.
It honestly feels a bit like what you see in tech, focusing on the user's complete experience. Like if the system's hard to use or, if it doesn't solve their actual problem, they just kind of stop using it. You see that with apps. Why not healthcare?
That's such a great comparison, David. Cityblock is essentially designing healthcare around the user, only in this case, the users are patients with incredibly complex needs. Their approach recognizes that unless you solve the underlying barriers, you're never really helping someone get healthier in a sustainable way.
Okay, but realistically, this must take a ton of effort. Like, aren't there limits to how far they can go with this for every patient?
Sure, there are limits, it is resource intensive, but the focus is on prioritizing those interventions that have the biggest impact. By improving someone's stability, whether it's housing, food access, or economic support, they're reducing costly emergencies and improving quality of life. Over time, it actually saves money for the system as a whole.
So it's a win-win. Better outcomes for patients, lower costs. It almost sounds too good to be true, honestly.
It seems that way, but it's really about focus. By centering care on the full spectrum of what impacts health, Cityblock's proving you can move the needle on some of these deeply ingrained barriers. And when it works, the results speak for themselves.
Hearing about how they're tackling those real-world barriers is impressive. But let's talk about the other piece of the puzzle, technology. How's Cityblock using tech to make all these solutions scalable?
Great question, David. Their entire model hinges on smart use of technology. They partner with tech platforms to track patient data in real time, predict outcomes, and even coordinate care across different systems. For instance, they've developed proprietary tools that allow their care teams to monitor which interventions are working and where patients might need more support.
Wait, like predictive analytics?
Exactly. Imagine being able to flag that a patient is at high risk of being hospitalized in the next month based on patterns in their data, like missed appointments or changes in lab results. That allows Cityblock to intervene early before it becomes a crisis.
So you're saying they can use all this data to essentially, stay ahead of problems?
That's the idea. And because their care teams are integrated, meaning doctors, nurses, social workers, and community health partners are all on the same page, they can act quickly and effectively.
Okay, that sounds brilliant. But let me ask, what happens when this tech meets, the real world? Are there limitations to how far they can take it?
There definitely are. While the tech makes it scalable, systemic challenges still get in the way. For one, policies around data sharing can be restrictive. Different payers or providers don't always play nice with each other. And then there's the issue of funding. Building and maintaining these systems is expensive, and not every state supports innovative payment models like Cityblock's.
Right, so it's not just about having the best tech, it's about navigating the whole infrastructure around it.
Exactly. That's why Cityblock's partnerships with payers and community organizations are so critical. They're not just innovating within their own walls, they're working to align all the moving parts in healthcare, including state Medicaid programs and private insurers.
But let me play devil's advocate for a second. Is this model something that can actually, reshape healthcare as a whole? Or are we talking about a boutique solution for underserved groups?
That's a fair question, and honestly, both answers can be true. Right now, Cityblock's model works best in targeted populations where the need is greatest. Scaling to an entire healthcare system, that's a whole other challenge. But what they're proving is that focusing on root causes and using technology to drive coordination can deliver better outcomes for patients while lowering costs. That alone could inspire broader change.
So it's like proving the concept at a smaller scale and then, hopefully, building momentum for something bigger?
Exactly. And one of the big lessons here is that when you design a system for the most vulnerable, you end up creating something better for everyone, It's not easy, but it's absolutely worth striving for.
Wow, Sophia. I gotta say, this has been eye-opening. I mean, I knew healthcare was complex, but seeing how Cityblock's tackling it with this mix of tech, partnerships, and honestly a dose of guts, it's pretty inspiring.
It really is, David. And I think it goes to show what's possible when we think beyond the usual constraints. Cityblock isn't just tinkering with the system, they're challenging us to reimagine what healthcare could look like.
And on that note, I guess we'll leave it here for today. Thanks for walking me and everyone listening through all this. As daunting as these challenges are, it's exciting to think about how models like Cityblocks could push us forward.
Absolutely, David. It's been great diving into this with you. And for everyone tuning in, let's keep asking the tough questions and pushing for better solutions. Until next time.